I think that's a really important topic for us to be paying attention to as dermatologists. It's something that we hear a lot about in the day-to-day practice of medicine. Many of the disparities that dermatologists encounter or that we're faced with are due to underlying structural inequalities in our healthcare system, kind of due to inequities in social determinants of health. And I think it's really important that dermatologists are aware of these barriers, of these disparities to providing high quality care to every individual or to providing access to every individual so that we can be proactive in really addressing them as we move forward as a specialty. I think for dermatology in particular, there's two challenges that I would say are underlying several of the disparities in our field, and those are access and quality. The United States is fortunate in that we do have a large number of physicians per capita compared to many other countries of the world. We have a large number of dermatologists per capita compared to other countries of the world. But that doesn't really tell the whole story. One of the things that's challenging in the United States as a very large nation is the distribution of healthcare resources, and dermatologists fall into that bucket. So it's been well documented that the distribution of dermatologists or the density of dermatologists per capita is quite variable across the United States, and this has many causes as well as many consequences. One of the causes for this is where people do their training. Often that is consolidated around urban centers where medical schools and large academic institutions are. And then where population hubs are is where a lot of people end up doing their training and often stay close to where they train to end up practicing. So this creates this overabundant supply in particular areas of the country, whereas a relative lack is seen in other parts of the country, particularly in more rural or less densely populated areas overall. There are fewer dermatologists per capita. So what does this do? This creates a challenge for access to dermatology that is uneven across the country and thus leads to one of the first disparities of dermatologic care. I think a second major disparity that affects dermatology that I'd like to mention or highlight, and that was a motivation for us in writing this piece, is the disparity of quality of the care that's provided. The absence of a dermatologist in a given county has been linked to higher death rates from melanoma in that given county, and there's data to provide support for that research in the past. I think that speaks tremendously to the role that dermatologists play in both screening and treatment of disease like melanoma and the real public health role that we do serve amongst the many hats that we wear as physicians. And so that's one of the reasons that we see disparities in quality of care due to the maldistribution of dermatologists. There are other factors that have been associated with poor quality of dermatologic care, including poor outcomes for ethnic minority individuals who are diagnosed with skin cancers in the United States. And that's another challenge that we need to be aware of within the field of dermatology.